Broadcasting live from the United States of America. You're listening to the Living Sexy Radio.
It's time for Stages of Life Radio with Dr. David Klein. Have a medical question? Call 407-422-1212. That's 407-422-1212 or text.
Commercial for us.
That
That's
is
okay.
a curve.
That was that was better than the curve that we got thrown initially. So, anyway, if you'll just give us 2 seconds.
23680.
Really? I want to hear that all over again. Let's do that one more time with feeling, everybody.
It's time for Stages of Life Radio with
Nailed
Dr.
it.
David Klein. Have a medical question? Call 407-422-1212. That's 407-422-1212 or text 23680.
Wow.
That was close.
That was close. Now, you don't even know. In Radioland, everything is perfect.
To the beat.
Wow. I nailed it. But before that, there were complications up to the last, I think, 45 seconds.
It was
literally.
pretty close there. I don't think it was 45 seconds.
It really wasn't. Someone threw in an extra commercial, save my hiney.
Just in case.
Just in case. So, time now, and officially we are live. Holy poop.
I'm taking my pulse. I know I'm alive.
Right. Phew, I know my heart's working. All right, so today on the Stages of Life radio show with Dr. David Klein, Klein's going to talk about the other inoculations, like they all got forgot about.
Yeah. Well,
I mean, there are a lot of things, and I noticed our own Alan from Good Morning Orlando,
Sure.
who we're tracking his progress with the COVID, when he got shot number 3, he also got his shingles shot.
that's going to make for a long day for Brother Alan.
Didn't seem to bother him too much, which was a
okay.
good
Well,
thing.
then he's a lot stronger than I am.
That's what I thought. I was like, I had to spread that out. So with that in mind, it's time now for Stages of Life Radio, and we're going to talk about the vaccines that you still need.
Yeah.
Go ahead, Doc.
Yeah, you still have to deal with the regular maintenance stuff. You know, just because you didn't get out as much as you used to, just because you didn't drive as far as you had to, you still have to change the oil in your car.
Oh.
You know, every so many months or every so many miles, whatever it happens to be, whatever the metric. When it comes to this sort of a thing, just because you survived COVID for now, just because you've eked by thus far, doesn't mean that you don't have to pay attention to the rest of your inoculation picture. Keeping yourself well is really only your responsibility. You know, the last thing you want to do is to end up being in some kind of neurovegetative state because you made some kind of dumb mistake or an oversight. Mm-hmm. And that's a real unfortunate circumstance with a lot of people. We're looking at COVID, 650,000 Americans thus far have died, but every year, 60,000, that's 1/10 of just about, will die of influenza. And we don't pay a lot of attention to that.
Well, not right now.
Not right now we don't, but we will and we have. So how many of those 60,000 Americans have died of influenza already? Probably 40,000.
Well,
we just don't read about it in the newspaper.
No, it's complications of COVID now.
Well, it could be.
Yeah, that's what they put down on their certificate.
It's because they get paid more.
Don't you give away all the secrets.
Here's the rest of that secret sauce. In the school system, the more kids with ADD, the more money they get too. Ooh. Therefore, more kids end up with autism and ADD than really exist. Well, guess what? So there's a lot of finger pointing to go around, but in the medical community, what you still have to look at is mitigating and minimizing your risks. Minimizing the risk to yourself, to your family, to your heirs, to the people that work for you, the people that you work for. All of these people depend upon you to remain as healthy as you can for as long as you can. Because it's not a lot of fun being sick. It's even worse to be dead. So what are we looking at? Okay, this pandemic changes nothing with regards to other infections. Now, I've had very intelligent people and some that weren't so intelligent come in and talk to me on a daily basis. Wow, you don't hear too much about influenza anymore. COVID chased it away. I'm thinking, Reese, what kind of idiot are you? I don't really put it that way because that's really unkind.
It's rude.
But I think worse, actually. And so I had this with a federal inspector who came in and who's telling me, well, influenza it's not occurring because COVID's taking its place. I'm thinking, these viruses don't really talk to each other.
Are you sure they didn't play tag?
I mean, what are you thinking? So you really want to know why we don't report influenza? It's because we don't get paid to. So if you test somebody for COVID and influenza on the same day, they'll pay you for one or the other. And if each one cost you a lot of money for the equipment and all the other stuff, you simply don't do but one or the other. Amazing, isn't it? Okay, and you can't expect anybody to. It's like if you go into the local steak restaurant. Okay, they'll either buy one steak or, I want one steak or give me two steaks, but guess what? You're only going to charge me for one. It doesn't work that way. They show you the door. So that's the way it is with medicine.
Okay.
Go figure how this works out. Well, it's all about money. If you want to pay for it, you can do it. And then people walk the other way on that. So what are the other, excuse me, gosh, I'm thinking about the upper respiratory tract.
It's COVID.
Yeah. So what are the other major causes, let's say, of respiratory illnesses, things that you have to worry about that you can be inoculated for? Well, we're not going to talk about allergies right now.
Oh, you mean like pertussis?
Pertussis, whooping cough. It's been estimated, I don't think it's accurate, but it's been estimated by the folks at Hopkins that roughly 1/3 of adults that have chronic cough, that means cough that is longer than 6 weeks in duration, have pertussis. Now, to that point, CDC has been coming out with these public service announcements. In the industry, they call them PSAs. In my industry, that's prostate-specific antigen.
Yeah.
So PSAs, they're bringing out these PSAs talking about, here comes grandma and grandpa, and you're coughing, and then they show these pictures of these wolves. I think that's pretty rude, actually.
Well,
but that's what they
Little
do.
Red Riding Hood.
I know the metaphor, but even still, to call grandma a wolf, grandpa maybe.
She's a wolf in sheep's clothing.
So chronic cough, bronchitis, and pertussis is something that actually can cause cardiac damage over time. It's an interesting disease. So just because your doctor, and I am one, told you that you have chronic bronchitis because you're coughing all the time, doesn't mean that you couldn't have pertussis.
Right.
And pertussis is a bacterial infection. It's very slow growing. It's a misery. The hallmark of pertussis, and I would write this one down, is coughing until you feel very nauseated or vomit, or pass out for that matter. Okay, that's the key. That's the key symptom of pertussis. You cough hard, and then either get really, really dizzy, want to pass out, or vomit. Pertussis. And you need to talk to your doctor about that. That is something that you really, really have to deal with. Can you see pertussis in these sorts of environments? And the answer is, of course you can. People are staying very, very tightly, close together in their family groups, and this is just how it happens. One of my favorite ones, is mumps.
Oh.
Now, how long do you really think you maintain immunity to mumps?
Yeah, I don't know.
10 years. I'll give you a little clue.
10?
10 years. So when did you get your mumps vaccine?
When I was like 2.
2 or 3? What do you know about that? So by the time you hit high school, you're already vulnerable to get it again. And this is where it gets interesting. Because an adolescent, an early adult that gets mumps can become sterilized, especially men.
Oh.
Okay, so it's a way to sterilize the boy next door. So this is what can happen if you're not truly in understanding of what you're doing, and it can happen anytime during your life. So what is it that mumps looks like in an adult? It doesn't look like it does in a kid. A kid looks like they're chipmunks. You kind of have a pretty good feel for what's going on. Fever, they look like chipmunks, good. Anybody can make that diagnosis. But an adult, it doesn't work that way.
Oh.
It can be on one side of the cheek. You'll see somebody that may have a swelling in a gland under the jaw. Well, it looks to me like you have tonsillitis. Out go the tonsils. You still have mumps. How nice. And you can have mumps in many different types of glands. The testicles is my favorite one. Why? Because that's what causes sterility. Pancreas, it can cause diabetes. If you end up pancreatitis from mumps, you can end up with a lifelong illness called diabetes. It's a bad thing. Oh. So every gland in your body, very few exceptions, can be victimized by that particular organism. So mumps is something that you should get. MMR is what you can get, these triple inoculations, and you do them every 10 to 12 years. So we'll come back to this in a moment because I've got a couple more things to scare you about.
Oh, we're talking inoculations.
Inoculations.
And not the COVID vaccine.
Not yet.
Not yet. I know it'll come up because unfortunately it's still very, very strong in the narrative. But until then, 23680 is the text line. If you want to call in, get on board early, 407-422-1212. And you can always check out stagesoflifemedicalinstitute.com for all kinds of information. We'll be right back. Yay, it worked. Hi, guys. Thanks for listening. Thanks for watching us on Facebook. Hi. Hi, it's me. Hi. Let's look at this other view. What happened there? I think I hit the camera. Didn't know about Mumps.
Did you get the parakeet view?
Yeah, look at that.
There's
That
the parakeet mirror.
Yeah, there we go. That's better. All right. So, inoculations. I love saying it like
Yeah.
that. It's inoculations.
It's actually probably that's the appropriate way to say it.
Inoculation.
Inoculation.
Inoculation. Yeah. It is, but it sounds weird.
Well, it's Americanized.
Yeah.
It's all good. It's just like anything else. I took anatomy from these folks that were British.
Oh.
So you ended up hearing a lot of interesting UK mispronunciations.
Aluminium.
What's that? Aluminium being a good one. But looking at the skeleton.
Oh, skeleton.
Yeah.
Yeah.
Everything has got this on the second to last syllable.
Yeah, accent on the wrong syllable. It happens. It does. All right.
They're good people anyway.
Yeah, the Brits.
Yeah, in spite of their speech impediment.
Oh, impediments. Oh, wait, 13. Hold on, I gotta do more math. And 8 and 11. That's not gonna work. Oh, wait, did I do it? Nope. I try to do math. I can do radio math. I can count backwards from 60, but any other
By sevens?
No.
There you go.
By sevens? No.
By 15s, I bet you can.
They have me do, yeah, that's not too bad. But sevens, and you have you do that from 100 to like 93.
Yeah, well,
That's about what happened.
Well, when I used to do anesthesia, and I did for a long time, it's a great way to earn a living. I used to whisper into people's ears, you will pay your anesthesia bill first. Post-hypnotic suggestion.
Right, it
101.
was. All right, stand by. We're getting ready to go back to the radio. Hey, Linda. Hey, Tanya. Hey, Ian. Hey, gang. We have a lot of stuff building up here, which is good. Welcome back. Stages of Life Radio on News Radio WFLA Orlando. Melissa Fox in the house along with Dr. David Klein. Stages of Life Medical Institute right down the street in Longwood, Florida. Pianos throw off of I-4. Check out FloridaLaboratoryAnalysis.com for all kinds of COVID antibody testings and that ilk, right?
You betcha.
Okay.
And it's done right. And it's something we can talk about when we're done.
When we're done talking about the regular inoculations.
Yeah.
All right. So, Dr. Klein, you were talking about pertussis and then mumps, and you scared a few people with the mumps thing because they don't realize that a teenage boy or younger, perhaps, can become sterile if the mumps virus settles in the testicles. So.
Yeah, it's kind of it's just one of those sorts of life-changing events, especially if you're looking for grandchildren. It might actually be a good thing. You never know. So mumps is one of those sorts of things that can have some interesting untoward sequelae, some problems, some complications, some that you may not even realize for a decade or more. We're trying to get pregnant, and then all of a sudden you find out that you're really not the problem.
You got no swimmers.
Nope, not there. So there are other issues that can happen with mumps, but diabetes is my most favorite. So you end up with somebody, well, there's no diabetes in my family. Why should I have it? And then you get to take it a rung backwards to find out when they got it. And I had one patient like that very recently. So, a guy came in, he couldn't understand why he had diabetes. Why am I doing this? He was basically insulin dependent. And we talked about it. And we worked our way backwards to an event that he thought was just really a bad influenza. And it was mumps. And that's just the way that it works. So what other sorts of things? Well, we talked about influenza. And again, COVID's killed 10 times as many people as influenza. If you're one of the people that died of flu, you're still dead. So getting that particular inoculation is really not that big a deal. Now, compared to the COVID vaccine, it's not a big deal. Okay, and I'm going to give you a little inside information on that in just a few minutes because I just took my third vaccine, and I've got an experience with it that really kind of shook me up a little bit. Shingles is one that we need to think about. Now, they're approving shingles vaccine down to people in their 50s and younger.
Are they now?
Oh, yeah.
Good.
It's a good move because the youngest patient that I've seen with shingles was 14.
Yeah, I was going to say, it's not something that's age restricted.
No, it is not. And so what is it with shingles? So you can develop, you can get chickenpox pretty much at any age. It's the most infectious of all infections. It's the most virulent. So what happens is this. Yeah, you end up with a reoccurrence of it. It can be 10 years down the line. It can be 20 years down the line. It can be 50 or never. But you can get it more than once. So if your immune system is not working as it should be, and these days we are all experts in immune systems. We all know that we can walk right into the pharmacy and buy something on the shelf that says, this boosts my immune system. What? Be careful what you buy. But the fact is that shingles can cause a life-changing problem called post-herpetic neuralgia. And again, this is something that I see many patients and have for decades. These are people that are on medications for the rest of their life for pain that follows shingles, and it never goes away. It is a bad deal. And what can you do about it? Well, you can either pray, which is not a bad thing to do, but it doesn't help very much here, or you can get the shingles vaccine, which is brilliant. Okay, I got my first one about 6 weeks ago. I'm due to get my second one in about 2 weeks.
I'm thinking
now,
about
does
that.
it hurt? That one has a bite to it.
Yeah,
okay?
but shingles
is it
has
worth
a
it?
damn bite to it.
You want to? I can give you a long list of people that would rather take that vaccine
Any day.
than to suffer with what they're suffering with.
Definitely.
So the shingles vaccine is something that you need to do. But 1 person in 10 that develops shingles will end up with this post-herpetic neuralgia. That is a big number. That's a lot of people, and it's a lot of misery. 1 in 10. So should you start developing things that look like shingles? Now, if you go on Google and look at the pictures, you'll see all the very worst cases. Most of them are not even like that. Most of them,
cool.
No, it's very, very cool. Most cases of shingles, you may see 12, 30 little tiny bumps. It looks like little insect bites. And you're going to know that it's a problem because you start looking for the insect. But I'll tell you what funny thing about insects, they're smarter than you think. They don't typically bite you and then not move very far. Okay, they bite you and run because they don't want to get swatted. It's a life-saving thing for an insect not to bite you and hang around.
Bite and flight.
So if you see 12 little bites in one location and you're not standing on a fire ant hill, okay, you're looking at shingles until proven otherwise. And you have roughly 3 days to get that treated before it starts to become somewhat untreatable. And that becomes a bigger issue. So 3 days, you have to call your doc. If you want to call me, that's fine, but call your doctor up, look at it, and understand that most of these cases go undiagnosed because they don't look like the pictures in Google. The last ones I want to talk about before I plan to digress, actually, is tetanus, typhoid, and polio. Now, these things are still out there. Tetanus, we get tetanus shots, every so often. If you go to camp, summer camp, you go to college, you're supposed to get it. Why? Because they're expecting you somewhere along the line to get bitten by somebody, poked with something, or cut in some manner. The whole thing about the rusty nails is nonsense, but any puncture wound can cause tetanus. Very interesting. Typhoid, if you're on well water, you know this problem very, very well. So you can see it with well water. You can see it with certain types of food issues, water issues in particular. Polio is going to see a comeback in this country. It's gonna come back like the Beatles. I'm still waiting for the Beatles to release more of their tunes. It has to happen soon. In fact, I think it just did. So what should you do? Talk to your family doc. Talk to your internist. Talk to somebody about getting caught up with these things. Because just because we're in this pandemic doesn't mean you can't do something a little bit different.
Most definitely.
Now, with regards to the COVID vaccine, so I went out and I've been promoting people to get tested for their antibody levels. And one of our callers, sent in, well, do we know the number of people that have long-term immunity after getting COVID? And I'll tell you what my research has told me. Now, you can go out and do your Wikipedia nonsense, and you can go out there and do your Google searches and read these blogs that are out there. But I went ahead and dropped a lot of money buying equipment in a laboratory. And we've been doing immunoglobulin quantitative. That means how much this stuff is floating around your bloodstream for the past year and a half. This is data that the feds say, well, we're still waiting to get that data. I can't even give it to them. They're not interested in answering the phone. But what I will tell you is that, generally speaking, people that end up catching the disease, as I did in January, develop immunity that's not nearly as great as if you got the inoculation. And that's with about 4,000 patients, 10,000 data points. That's a lot of data to look at. Now, what about long-term immunity? You're going to end up with T-cell immunity, provided that you have adequate T cells and you don't have things like HIV, disorders that cause T-cell issues. So most everybody is going to end up with some long-term immunity. Now, what does that mean? So now that you've got the answer to your question, what do I know the number of people that have long-term immunity? Sure. It's the total number of people that have been infected plus the total number of people that have been inoculated at least once. That's about 60% of the population. But the question is how many of those people are vulnerable to get the disease again? And the answer is about half of them. Why is that? Because the typical person will end up with IgG for about between 3 and 6 months after their last injection. Why is this important? Because nobody wants to get sick again. Nobody wants to end up getting sick, not know they're sick because they don't get quite as ill, and then give it to a bunch of other people. And that's just what's going to happen. So what we've been doing is drawing blood, figuring out how much antibodies were in place, and then making recommendations to those individuals that are running a quart short, as it were, to go get that third immunity. And if you listen to us on Tuesday morning at 7:10 a.m. this week, probably the week after, and perhaps even the week after that, we're going to go ahead and walk the numbers for the morning hosts that we're doing this for. These individuals got checked for their gamma globulin. They were, let's say, short. They didn't have enough to actually generate much of a response, and they got their third vaccines. And so we're measuring now how long it takes for the immunity to jack up after that point. And what we're finding, preliminary work does suggest that it takes 3 weeks for the immunoglobulin to go up as opposed to the 8 to 12 weeks if you've never been exposed to it before. So that's about a 6 to 8 week head start, let's say, and that's what's saving people's lives. That's what's doing it. People typically don't die in the first day or two of getting COVID. They usually die in the 10th day or after. It's the immune system that really trashes them. Now, I went ahead and did something that I really haven't suggested to anybody else, but I wanted to go see, being the wise ass that I am, what would happen if I got the vaccine, third one. My immunoglobulin level was 12. My wife was under 2. Our hosts on the AM show, under 2. Mine was 12. I went ahead and got the inoculation, and it knocked the crud out of me. So I was sick for about 30 hours. Now, the first 2 didn't touch me. Third one, man, I thought every bone in my body was broken. You know, it was kind of a rough 2 days. Now, why does that happen? Why do I think that happened? Because my body was able to really throw up a good immune response. I didn't get COVID, but I sure as heck had every symptom short of the loss of sense of taste and smell. Everything else hit me. The cough, the hacking, feeling like, the bone-breaking discomfort. The headache was astronomical compared to what it had been. My wife has chronic migraines. She knows what headaches are all about. Man, if hers are worse than that,
Right,
maybe I should be more empathetic.
Nice. Yeah.
It should be nicer.
Right.
It's hard for me to be nicer
got a couple
anyway.
questions about your chickenpox / shingles.
Go for it.
First of all, Tanya said that her kid's pediatrician gave her an inoculation for mumps and rubella after she got the chickenpox when she was 29 years old.
Yeah, it's about right.
Sounds about right,
Yeah.
Sarah Grace,
congratulations for your internist, because
right.
that's exactly the right thing to do. What they missed was pertussis. So I would be going back to pick that up.
I think this was a minute ago.
DPT.
Sarah says, are those of us who had chickenpox in childhood more or less vulnerable to shingles?
Less vulnerable, but people only get shingles if they've already had
If you
chickenpox.
had it, yeah.
So
Thank you, Ian, for clarifying that. Take a quick break. Check the news at the bottom of the hour here. Remember, Stages of Life Medical Institute.com, kind of a landing pad. You can check out the nutraceuticals as well as all kinds of medical information at your fingertips, and believe it or not, free. We'll be right back and take some phone calls and texts, etc., etc. And find it. It's going to get there eventually. There it is. I found the button. It gets so
Yeah,
small.
sometimes it gets pretty close there, doesn't it?
Yeah, let's see if Craig.
Hit
Craig,
that
you on
button.
there? Craig? I don't know if Craig can hear me.
Hello?
Oh, there we go.
There you are, Craig. How you doing, bud? Can you hear me?
This isn't Craig.
Peter. Peter, I
yes,
changed your
Peter.
name to Craig.
Well,
and-
it's so nobody will recognize you.
Yeah. You're anonymous. Okay, Peter was
Okay.
diagnosed with a prostatitis.
Prostatitis.
Yeah, and given an antibiotic, and you say you're still in pain 2 weeks later. What to do?
Exactly.
All right, Peter, how old are you?
I'm your patient, Sergeant White. You know me.
Oh, sure enough. Okay, there we go. What? Not
Gives me
recognizing
such
your...
a rash.
Okay, prostatitis is a misery. Now, the prostate...
sure is.
Oh, the prostate gland is in kind of a miserable location. Okay, it's located, between the rectum and the seminal vesicles, and so what will happen, right? You have to pee through this gland basically. So what can happen when the prostate gets infected? It starts to swell. It makes it very difficult for men to urinate or at least empty their bladders, and it also makes it really painful to sit in certain ways, especially on bicycle seats. Believe it or not. So. You've been given an antibiotic, and yet 2 weeks later you hurt. One thing I will tell you about prostatitis. Infection of the prostate is darn near impossible to clear.
Eesh.
Okay, you can control it, but you can't cure it. Why is that? The prostate gland is a lot like a sponge. Okay, it's got all these little holes, crannies, nooks. It's very much like a
Sounds
rabbit
like a
warren.
Thomas English muffin.
It's like a Thomas English muffin. If you take a sponge, a kitchen sponge, and you pour coffee grounds on your counter, and you go to wipe it up, see if you can get all of the
You'll
coffee grounds
never.
out of the sponge. You can't. If it's Kool-Aid, which is little tiny blops of red, green, or yellow, you can't get that out of the sponge either because those little bits of dye end up in areas that you can't get rid of. Imagine that's bacteria.
Yeah.
Your body never quite clears it. So the way I prefer people to deal with prostatitis is to take the antibiotics as prescribed, usually for 2 weeks, but sometimes for as long as 6, to get the pus under control. And then you control it on a chronic basis with something called N-acetylcysteine, or NAC, which does 2 really cool things for a guy with prostatitis. One, it thins the prostatic secretions so they drain. So if you think of the infection of the prostate like a multiloculated abscess, okay, it thins it so it all drains out, or much of it does. But it's also a gram-negative antibiotic. So it's very, very cool stuff. The second thing you want to do, okay, is to stay on it. Okay?
Stay on the
Because as soon as you
antibiotic.
stop it, man, you're going to do something and you're going to wake up peeing pain.
Oh, wow. Peter, that does not sound fun. Thanks for calling the show.
Hey, is that NATC? Is that a prescription item?
It used to be. It's called N-acetylcysteine. We have it in the office. NAC, the 500 milligram capsules 3 times a day. When you stop by, I'll hook you up. Don't worry.
Oh, boy.
Doc,
Multitasking.
thank you, sir.
My
Thank
pleasure.
you, Peter.
Thank you very much.
As you were, Sergeant.
They're like, did we miss something? No, you didn't. We take phone calls and we do question and answer during the commercial breaks on the radio on our social media platforms. We're on Twitch, Periscope, Facebook, LinkedIn. I don't know why.
LinkedIn.
Yeah, I don't know.
Are we really?
Yeah. But anyway, yeah, so we take phone calls and questions during the commercial breaks, and now we're back on the ready to go. So it's time for us to take some phone calls as well. There, 407-422-1212. We got a question here about the different anti-inflammatory meds, how they work, and which ones you prefer to prescribe.
Well, there's a question that's going to take about 2 or 3 hours to explain. Okay, the first chemical modulator of inflammation, the first one ever discovered was histamine, believe it or not. So your antihistamines are actually anti-inflammatory medications. Why is that important? Because inflammation of different tissues is typically caused by inflammatory cytokines of different natures that are treated with different medicines. So you treat, let's just say things like sinusitis, very, very different than you do vasculitis. If you've got somebody with an inflammatory problem called migraine, that's treated very, very different than the inflammation in the gentleman that had prostate inflammation or infection. So what's my favorite? It really depends on the circumstance. So if somebody has arthritis, and the context is almost always this. I have bursitis, arthritis, tendonitis. What's my favorite? anti-inflammatory. And then it starts to narrow down a little bit. So there's cyclooxygenase 2 inhibitors, there's cyclooxygenase 1 inhibitors, not only enough, there's cyclooxygenase 3 inhibitors, and they all seem to work in different tissues. So when somebody has headaches, neck pain, arthritis of the neck, my favorite one's naproxen. If they have sacroiliac arthropathy, lower back pain and facet, I tend to use meloxicam, sometimes known as Mobic. If you have individuals with stomach problems and you need to use the above, you can use Celebrex, although it's not nearly as good as the others. Yeah. So my favorites are typically that. Now, if I have to go transdermally, and I do a lot of that because it avoids the stomach, liver, kidneys, and whatnot, then I will typically go with diclofenac for certain areas of the knees. I go with florbiprofen for tendon, and I typically add gabapentin to it if there are things like carpal tunnel syndrome, which has a different type of inflammation involving the nervi nervorum and vasovasorum vasonervorum. These are structures that cause carpal tunnel syndrome. But that was a mouthful. Wow.
Yeah, it did sound like some sort of Mary Poppins or Bippity Boppity Boo.
No, it's actually very important because you have to know what you're doing. It's kind of like, well, gee, what's your favorite mixer if you're a bartender?
Yeah.
Well, it really depends
on the liquor.
It depends on what the customer's asking for.
Yeah.
Okay, so you have to serve that which is necessary.
So if you've got the general blanket of what you like there out, can we move on to the next thing?
I think so.
Okay, all right, good.
Yeah, you had that. You got that look for me, didn't you?
Yeah, I sure did.
I have more to say.
Hi, Ray is on the phone. Now, he's 67. Is that right, Ray? You got your first Moderna shot. Now you want to know how long you should wait to get the second one?
The answer's 4 weeks. So they typically schedule you right then and there. So you get the first one. They give you a 28 to 30 day calendar. Let's schedule it and get it done. My advice to you is to schedule it and get it done. Why? Because dead people make very bad company around the house.
Yeah, and they don't keep their appointments. So Ray, 4 weeks.
In Pfizer, it's 3 weeks.
Got it.
And so if you have Johnson & Johnson, just go get any of the others. Just do something.
Save yourself.
Yeah.
Let's see what we got. People are asking, you mentioned that you'd be on the radio, on the social media. They don't realize we're on the radio.
Oh, already? Oh, okay.
No, we'll be doing that on the same radio station we're broadcasting on now. That would be WFLA in Orlando, 94.1, 93.1 FM, or AM 540, and we're always on the iHeartRadio app. So 7:10 would be in the middle of the Good Morning Orlando show.
Yes.
So that'll be fun. And
I chime in for, I don't know, maybe 8 to 10 minutes, depending upon what the circumstances.
It does depend. Okay, so now we have another question here. If I get the COVID antibody semi-quantitative IgG test and I find I have high antibodies, should I still get the booster? I finished my first vaccine. I had 20, my wife was 10. You guys are good for a minute.
Yeah, there we go.
Yeah.
So what happens is at 20, you're likely to go about 4.5 to 5 months. 10 is going to go maybe 3. The way that you figure this thing out is it cuts in half every 60 to 90 days. So you're going to go 20, 10, 5. And it gets weird when you hit about 2.5 to 3.
Yeah.
You don't want to make it down to 0 because that leaves you, let's just say, unprotected or relatively unprected. So there's a little bit of an art to this.
You also don't want to get it when you've got 20 IgG
because
level.
I did it at 12.
It's a bit overkill.
And got sick.
Yeah,
okay.
Too much.
Very, very, very unhappy with myself.
The thing is that at a lot of the places, I won't mention the ones that you can just walk in and say, hey, I want to get my shot or a third shot. They don't ask if you've had. Some places are not being thorough. Other places are being stringent and thinking that people are lying when they're coming in with doctor's notes.
Yeah, it's amazing. Because as you know, if you know that if you know your levels, you know how we handle things. So we'll actually give you a piece of paper that documents what that level is and how to interpret it. Which is kind of an important document to have. A letter with it that says your doctor suggests that you do it. What I would do, if your level was 20, I would recheck it in about 8 weeks. See where you are right then. If it drops much below 10, then you tap off another 8 weeks and you should be good to go.
Hey, Wally. I can hear him talking. Hey, Wally. Wally's 82. He's got a question about the booster. Go ahead, Wally. You're on the Stages of Life radio show.
Well, actually, Melissa, thank you, but you just answered my question. That was me on the text line.
Oh, okay.
I'm an 82-year-old guy with the score of 20.
Yeah. It's a simple arithmetic. So if you look at it, it's a logarithmic degradation. Logarithmic degradation, which means it cuts off by factors of 50% every so often. But the hard part is figuring out what that time length is. So with my wife, it was almost exactly 90 to 120 day range. With me, it was just a little bit longer. So if we get a second piece of datum, we should be able to figure it a little bit closer. But I wouldn't get the darn vaccine until it drops much below 4.
Yeah, especially after what you just went through.
No, I just went through it. I did myself as a little bit of an experiment.
Well, he also wants to know if you took anything after your third vaccine, in other words, something to temper the...
Never do you want to do that. There's no point in getting a vaccine if you're going to take something that's going to make your body not respond to it. So I took nothing but Tylenol. And I'll tell you what, that Tylenol was very useful. You take 2 of those puppies every 4 hours, and it makes you human again for 4 hours.
Wow.
But it was
when it knocks off. Huh?
It was bad news. I sat in the tub. I sat in the hot tub twice, 3 times to try to get the muscles to work. It was a long time, but I wouldn't even take MSM or any of the other things, or turmeric for that matter, because you really don't want to temper, blunt, or in any other way impair your body's immune system for this purpose.
Text line is open at 23680. Again, 23680. Mash that into your message app and send us a question if you like. Or you can call in. The phone line's available, 407-422-1212. We started out talking about inoculations that need to be taken because everybody's like, all COVID. And we're forgetting about the normal stuff again. It's the same thing that happened during the lockdowns last year. We forgot about our normal, general patient, doctor stuff.
Just the
that we
usual
needed
stuff
to
that
do.
you have to do.
Just crazy.
Cancer screenings, they need to be done. Your typical, I need my blood pressure taken care of, my diabetes maintained. All of these things have to be done. And it doesn't do well, in particular by telehealth.
No.
Okay, telehealth is cute. Well, we're going to go ahead and do it by telehealth. Okay, that's great if you're coughing up, COVID. Nobody wants to be around you. You can walk in, however it works out, with a test that says that you've got it, and then you can start taking positive or whatever type of action you see fit.
Right.
But for the most part, it's not one of these do-it-yourself type deals. Now, I've been looking at these DIY drive-through COVID testing. Okay, this is insane.
Hang on,
okay.
Mike.
Insane. Drive through. They're going to hand you these swabs. They tell you to run it into your nose, wick it around a little bit, do the other side, wick it around a little bit, and then shove it into this piece of paper. These are $6 antigen tests. Okay. Do you know how useless those things are?
Yeah, pretty useless.
Pretty useless. So if you think it's going to make any great difference, so when people call me, I think I've got COVID. Why?
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 Now, we were talking earlier about the shingles vaccine. Ron
Sure.
is on the... Ron, you there? Okay, Ron, you want to know about some possible side effects of the vaccine for shingles?
Well, I had side effects from the shingle shot. I got it in October of last year, and I got the booster in the first week of December.
All right.
And ever since then, I'm really tired all the time, but I noticed that I'm injuring or tearing ligaments, tendons, and muscles. It's just not good.
No kidding. Yeah, I've not ever seen that, but have you taken anything like Levaquin or Ceftin or any of these antibiotics?
No, I haven't.
In the recent past, none at all? Okay, because they're notorious for doing
and
that.
right after I got the shingle shot, within about 3 days, I got the little bumps that you were talking about.
Okay,
and
well...
my doctor said it wasn't shingles, but it came up and it lasted about 3 months.
Yeah, you may...
Hang on just a second, Ron. We're going to take a quick commercial break.
We'll be right back with you.
We'll be with you in just a moment. Yep, hang on.
That's interesting.
All right, make sure you support our sponsors here at Stages of Life Radio. We are sponsored by Pharmacy Specialists in Maitland. They are a compounding pharmacy, and they're very good. Doc has worked with them for a couple of decades now. So, again, the phone line is 407-422-1212, and the text line, we got a lot of them coming in, 23680. All right, Ron, back at you.
All right. Yeah,
Fine.
Yeah, it's entirely possible, okay, that you could have ended up actually reactivating the shingles.
Yeah,
That can happen.
that's what I was thinking.
Yeah, you just stimulate the immune system and then off she goes. So if that's the case, then getting started on some antibiotics, antivirals wouldn't be a half bad idea. Are you still breaking out?
No, it lasted about 3 months.
Yeah, I mean that's
it
sure.
was around the socks or ankles, around the waist, the tummy, and around the shoulders and on the neck.
Well, that's what it sounds
Wow,
like.
that's typical.
Yeah, that's I would have. Yeah, that's that. I would have thought that's what happened there. So can it happen? I guess it can.
Yes, it can. Yeah. Well, hey, thanks, Ron. Appreciate you.
Yeah.
Real fine, but is there anything we can do at this late stage?
Well, so just for the fatigue, there are a couple things I would do. I would go ahead and get a cortisol level on you. The two things I would get would be a cortisol level and something called a interleukin 6 level. I would want to know what your immune system is doing. So there's some blood. There's some.
Probably make an appointment and come over to your shop.
Give me a holler. Hey, you got my attention there, my friend.
Guess
you so
what?
much.
We're already back. Can you believe it? And we're still talking with Ron. Thanks, Ron. All right. Welcome back to Stages of Life Radio. Hey, man, it's a busy deal here.
Yeah.
It's a very busy
I want to find
day.
out why his immune system is impaired.
I wonder why.
When it happens, it happens. I want to know why.
It does, and you do want to know. That's the kind of doctor that you are. Welcome back to Stages of Life Radio. I'm just going to try and get the music to start. Just occupy yourself for just a second. All right, which one is it? It's this one, right? Okay, let's see. Maybe? Yeah,
There
okay.
we go.
Welcome back. All right.
Yeah, without the music, we're just out of our sorts.
I know. It just you got that. You got to have that finger popping, knee slapping stuff. Okay. Thanks for the call, Ron. And again, we take phone calls and questions on the social media platforms when we're not running the radio show. Yeah. Yep. Multitasking. It's just pretty much an hour, nonstop. And you can always go back to Facebook or YouTube or any of those sources and replay the show at your leisure. Candidiasis.
Okay. All right,
Let's
so-
see. Do you recommend? Wait, where's that one?
Let's start it off down below.
It did start there. How would you treat extreme candidiasis, including in one's digestive tract and lungs?
Assuming that that's the case.
Wow, okay.
So in other words, you have an upper respiratory, or let's say a candida pneumonia or candida bronchitis. What you're going to do is you're going to end up using a combination of oral antibiotics and something called grapefruit seed extract. Third thing would be olive leaf extract. You take this. These are very, very interesting antifungals. Now, as far as what do you take by mouth, I would probably start with diflucan. So you take diflucan by mouth along with it, and that should clear it up. But you have to be very, very careful about pulling sugar out of your diet. Sugar has got to go. Sugar to Mannalia is kind of like Coca-Cola to a kid with ADD. It just sets things off like crazy. So that's pretty much what I would do. So what else we got down there? Because we're like on short time now.
Yeah, I know. We're on here. Let's see. What else can I take to lower cholesterol besides
let's grab the first one. So
Which one you
the
want?
first one
Blood
right there. Got blood work. The antibody level was 1.7 2 weeks ago, but no one will give you a third shot. Try the CVS in Apopka. It's on the north side of the road on 436. I had a little chat with the pharmacist out there.
Or just before Park?
Was just out there. I'm not sure. I couldn't find my rear end with both hands. When it comes to Apopka, I don't know where it is.
Just before Park.
Yeah,
Avenue.
but the CVS, the pharmacist there is a smart dude. Okay, go in there, take your data with you, and he'll take care of you.
All right, let me see. Is this the same Ron? Hold on. Okay. Let's see. Do you recommend taking 2 colostrum tablets a day as antiviral?
Absolutely. And the other thing you want to get is N-acetylcysteine or NAC. There are 72 published articles on the National Library of Medicine looking at NAC as a preventative for COVID. So the answer is yes. The dosage that they recommended, it was kind of hard to pull it through there, but 500 milligrams 3 times a day should do the job.
Okay. All right. Let's see. There was something else here, too. Any issues with getting the booster at the same time as the flu vaccine?
It's just fine.
No problem
It's
there.
perfectly reasonable. Now, the problem with that is that if your antibody level is too high, okay, and you get the booster, it's going to cause a bad day for you. What you don't want to be doing is making it worse with the flu vaccine. So my recommendation is to get the booster and then go back a week later to get the flu, because you just don't know how you're going to react.
Right. I mean, I've seen them giving them at the same time, but I
think it's about as lazy as getting the Johnson Johnson vaccine.
irresponsible.
Yeah. Just take an extra hour out of your life and get it done right.
Just do it. It's not an issue there. I think we have Ron, but I don't know if it's the same Ron or not on the phone. It's a different guy. Okay, let's see. This modern technology is so cool here. Just talk amongst yourself. Ron? Hi, Ron. How you doing?
Oh, it's Rick.
Rick. Oh, it's
Yes,
Rick. then.
we're changing people's names today. No charge.
No charge at all. Hey, you are now Rick. Hi, Ron.
I
Rick.
called last week, but I didn't finish. 3 brief questions on your topic. I have allergies and asthma. I take Brio and antihistamine and Flonase or Nasonex, whatever I can get
All right.
free from the insurance. I read I have less chance of getting COVID because the immune system works more and the medication kind of mitigates it.
Yeah, I would be selling you a bridge in Florida.
Okay,
There's
first
land
off-
for sale.
First
in the
off, the
Everglades.
Flonase is bad. The steroids are bad.
Brio shuts down your secretion of cortisol. It actually makes you at increased risk of getting these illnesses.
Oh, gosh.
Yeah, and so if your problem is just allergy and they've got you on steroids, it makes no sense at all. What you can take.
Well, I have asthma too.
Okay, well, asthma is a little bit different.
Mild asthma.
Mild asthma. So they're giving you heavy-duty medications for mild asthma. I have mild asthma. Okay, Melissa here has mild asthma.
That's right.
Neither one of us will touch either of those two medications because they shut the adrenals down.
Yeah.
I can't think of a worse thing to do to you.
Yeah.
If
It's like
you need,
cement for me.
yeah, it's nonsense. It's just awful. Were I you, and I had problems with allergies, I would be taking things more like quercetin, which is spelled Quercetin. The British say quercetin, but quercetin, which is a membrane stabilizer, marvelous for the treatment of asthma.
Take 2 a day.
Yeah. You want to go very, very lightly on the antihistamines because they tend to dry you out, and you don't use any of the steroids at all. So that's kind of what I would be thinking for that. Now, there are other things you can do if that fails. But
I have to take the Zyrtec, otherwise I'm miserable.
yeah, well, Zyrtec stops working after about 3 weeks,
Yeah,
and then you end
build
up with
a
rebound from
tolerance,
it.
Yep.
Yeah, so what they've done is they've crippled you. I mean, congratulations to the docs for doing this for you. Zyrtec is useful very, very briefly. So if you have an episode, it's good for a few days, but then you stop it. Now, when you're looking at things like Singulair, okay, which is a leukotriene antagonist, that's a little bit different. Sometimes you can take that chronically, and it's very, very helpful. Even taking naproxen is better for you than taking the Flonase or the Brio. Yeah. I use Brio only in folks that are let's just say, pulmonary cripples with COPD. That's where it's useful. Asthma?
Yeah, but how do you stop it suddenly and then don't?
You can't stop it suddenly.
Yeah.
Therein lies the problem. It's like being an alcoholic and stopping suddenly. You'll find out the hard way. So you have to taper it off. You may go every other day with it. You may go every third day after a few weeks or a month on that. But understand that the shutdown of the adrenal glands can take years to fix. And that when you do blood work and do it properly, you'll see this every time. ACTH level and a cortisol level, you'll watch that and you'll see what damage was done.
Thanks, Rick. Appreciate it.
Good question. Bad answer for
Love it when I change their name.
No. Well, it's like it's hi, this is John.
I don't know. I didn't do it this time. It wasn't my fault. Okay, so let's see what we got. What happens to natural immunity from having COVID if you take the vaccine?
What happens?
See, some people are worried about it, canceling out what immunities you may have gotten.
No, you're
Would it be an enhancement?
You're thinking too hard. So if you get COVID or you get the vaccine, you'll end up with an IgM response first, IgG response secondarily, and a T cell response after a little bit of time. That T cell persists. That's the long-term immunity that they're talking about. But that doesn't mean that you're long-term immune from getting the disease. Getting the disease and having an element of immunity are two different things. I want you to think about the T cell immunity as if it were a head start in a race. So if you're in a 5K, all right, not that if I've ever ran in a 5K because I won't do such a thing, but let's say that you're in a 5K race and they spotted you 1.5 kilometers. That's kind of what the T cell immunity does. Otherwise, you're back at square one. So you're not starting the race at the starting block. You have got a leg up. That's long-term immunity. It doesn't mean that you're immune from the disease any more than you can state that the kids in Afghanistan wearing those flak jackets are immune from a bomber. It doesn't work. All right?
Don't bring me there. All right, what else we got here? Are people who have worked hard to build up strong immune systems for years the ones who have had severe reactions to the vaccines and required hospitalization?
Actually, no. What we're finding is the people that are ending up in the hospitals right now are individuals, for the most part, that have not been vaccinated at all, or, oddly enough, individuals that are ill in some other way. But there's a third group, and that's kids that are vaping.
Vapors.
And so what happens is you end up with these sorts of subsets. So it's unvaccinated people, individuals with diseases that put them at risk, okay? And the third thing is vapors. And so that's a shame. So if you've got kids or relatives that are vaping, you got to have a long discussion with them. It's not going to help, but at least you've done your job.
Right, exactly. I think that's almost it. So let's do some serious plugs. Did I miss one?
One last thing. Somebody's asking about cholesterol. So what else can you do besides inositol? The answer is high-dose folic acid, 5,000 micrograms, and something called bergamot. So there are things you can do for cholesterol and acetylcysteine for that way.
Without getting on to the statins.
You got it.
Yes.
Now we can plug.
Okay, let's do that because we have like 30 seconds to do
You
that.
got it.
All right, so the new patient portal and getting yourself started as a patient with Dr. Klein at Stages of Life is very simple. Just go to stagesoflifemedicalinstitute.com. Any products that were mentioned today, nutraceuticals, can be found at stagesoflifevitamins.com. And if you can't get enough of Dr. Dave, Stages of Life Radio, 24 hours a day, all day, all night.
Yeah.
That good?
Yeah, it drives me crazy too.
All right, say goodbye.
Adios.
You've been listening to Stages of Life Radio with Dr. David Klein. Check out stagesoflifemedicalinstitute.com or stop by 1917 Booth Circle in Longwood near the intersection of I-4 and 434. Call 407-679-3337. That's 407-679-3337. Dr. Klein accepts many insurances and Medicare too. Join us next Sunday at 4 p.m. on News Radio WFLA Orlando.